Last time we looked at some of the issues and principles relevant to an ethical analysis of any system, and particularly our healthcare system. Suggested that we should ask ourselves whether any system, and particularly a healthcare system, effectively and efficiently promotes human welfare. Does it make us healthier, enable us to live longer, live better lives? Is it fair or just? Do people get what they deserve from it? Do people who deserve access to it have access to it and access to those benefits? Does it respect other important values and principles like individual and professional self-determination and professional integrity? From the perspective of these criteria that we have identified for evaluating any system, but particularly a healthcare system, it would seem that there are many signs of crisis related to the healthcare system in the United States. Mappes and DeGracia, in the introductory section to this unit, identify some of those signs of crisis. The first sign of crisis identified by Mappes and DeGracia has to do with the fact that millions of people in the United States are without consistent access to health care and health care services. 46 million is a current estimate of how many people are without insurance. The number is going down somewhat as apparently Obamacare, or the Patient Protection and Affordable Care Act, have resulted in some 7 million more folks having insurance coverage. Now, it's not as if those without insurance lack any access to the healthcare system. In fact, hospitals are required to treat whoever shows up at their emergency room needing services. But the lack of health insurance means that people delay presenting for care, wait until faced with an emergency. Those delayed diagnoses result in life-threatening complications. Some say as many as 18,000 unnecessary deaths in the United States every year, simply because people present too late, often because they're not confident that they have any way to pay the bills that will be associated with their health care. For some, this reality is an injustice. It surely is a reality suggesting that human welfare is not addressed as well as it could be by our healthcare system. Another sign of crisis is the fact that healthcare costs are extremely high in the United States, even despite those cost containment measures we talked about as a part of the whole managed care approach to healthcare. You see here some comparative statistics. In 2003, for example, the United States spent over $5,600 per person for health care, compared to about $2,200 in Great Britain and right around $3,000 in Canada. And as a percentage of gross national product, or gross domestic product, we spend significantly more than countries of comparable wealth. The most recent data from the World Bank on per capita spending shows that clearly cost containment has not succeeded, as according to World Bank figures, we are now spending close to $9,000 per person for health care. Why are healthcare costs so high? I have made available to you on the course website a very interesting little YouTube video by a video blogger named John Green. John Green is actually a novelist who makes educational videos for YouTube as well. And I've linked for you his discussion of why healthcare costs are so high. Now, you should listen to that critically. He is not an expert, but he does mention the things listed here on this slide as all possible explanations for why healthcare costs are so high in the United States compared to other countries very similar to us, like Canada or Great Britain. He does not buy or is not convinced by any of those explanations. He argues that the primary reason for our higher healthcare costs is the lack of power that insurance companies and the government has in relation to healthcare providers for negotiating those fees that we talked about as a part of the whole attempt at managed care. Now, the issue is that in those other countries, the government tends to be a single payer or a single provider, and therefore has great power. You either do business with the government or you don't do business at all. And that means the government can be much more effective at negotiating reduced fees for services. Let's listen here to a portion of John Green's video.
Okay, and now for the big one. I'm going to lump inpatient and outpatient care together because in the US we do a lot of things as outpatient procedures like gallbladder surgeries that are often inpatient procedures in other hospitals. So we're just going to make it a big ball. That big ball is $500 billion more than what you would expect given the size of our economy per year. Why? Well, because in the United States, we do not negotiate as aggressively as other countries do with healthcare providers and drug manufacturers and medical device makers. So like in the UK, the government goes out to all the people who make artificial hips and says one of you is going to get to make a crap ton of fake hips for everybody who is covered by the NHS here in the United Kingdom. But you better make sure your fake hips are safe and you better make sure that they're cheap because otherwise we're going to give our business to a different company. And then all the fake hip companies are motivated to offer really low prices because it's a huge contract. Like, think if your company got to put hips inside of everyone in England and Scotland and Wales and Northern Ireland. I guess not everyone, just the people who need hips. But in the US, we don't have any of that centralized negotiation, so we don't have as much leverage. The only big exception is Medicare, the government-funded healthcare for old people, which not coincidentally always gets the lowest prices. So basically, Hank, in the United States, providers charge whatever they think they can get away with, and they can get away with a lot because it's really difficult to put a price on, like, not dying. This is a phenomenon called inelastic demand. Like, if you tell me that this drug that will save my life costs $7 a month, I will pay you $7 a month for it. If you tell me that it costs $124 a month, I will find a way to find $124 a month to pay for it. You can't negotiate effectively on your own behalf for healthcare services because you need them, and not like you need a new MacBook Air or the new season of Sherlock, but actual physical need. I guess it is like the new season of Sherlock. So basically, Hank, until and unless we can negotiate as effectively with the people providing healthcare as Australians and British people do, US healthcare costs will continue to rise faster than anywhere else in the world, and we won't get better healthcare outcomes. Hank, I know this video is long, although it could have been much longer, but I am so tired of people offering up simple explanations for what's wrong with our healthcare system. They say, oh, it's malpractice, or
Well, I hope you will listen to the entire John Green video, and I also hope you will listen to his conclusions here and throughout the video with a critical ear. Other people will have very different or somewhat different explanations for why healthcare costs so much in the United States. Some of the other signs of crisis to which Mappes and DeGracia refer have to do with the less than comprehensive coverage that many insurance policies offer. So dental and psychiatric care and long-term nursing home care is often not covered. He worries that we have very limited patient choice in the United States, often only able to go to doctors and hospitals that are within covered within our insurance plans, for example. And then, of course, there's a problem of layers and layers of administrative and bureaucratic complexity as a result of government and private insurance intervening between us and healthcare professionals. That inconveniences patients and doctors, and it adds a significant amount of cost to healthcare. It is one of the explanations for why healthcare costs so much in the United States. It may surprise you to know that although we often hear that we have the best healthcare system in the world, the fact of the matter is the statistics suggest otherwise. In many respects, we have poor basic healthcare, despite the high-tech virtuosity that we're all familiar with. The CIA World Factbook ranked us 41st in the world with reference to infant mortality, and 46th in the world for highest total life expectancy. Obviously, of course, these poor outcomes are related to poverty, and recent studies have suggested a growing gap in life expectancy based on one's income and the geography, where one happens to live. Most of the declines in life expectancy have been occurring in the Deep South, and in Appalachia, along the Mississippi River, and in the Southern Plains, and in Texas, areas often rural and where healthcare services are not as readily available, and where people enjoy lower incomes. All of that affecting a gap, a great gap in the outcomes and life expectancy among various portions of the population in the United States. Also, medical errors is a problem identified by Mappes and DeGracia. They estimate 98,000 deaths per year as a result of medical errors. And finally, the problem of a lack of a sense of professional integrity, producing low satisfaction among healthcare providers. I've described some of the mechanisms involved in cost containment, and all those mean a third party looking over the shoulder of physicians and wedging themselves between physicians and healthcare professionals and their patients, and often generating a feeling among healthcare providers that they are unable to provide the sort of artistry and care that they have been trained to provide. Another important factor is the pressure on healthcare professionals to see a specific number of patients, and the sense that they do not have enough time to give each patient the kind of attention they deserve. All of this is creating great dissatisfaction among healthcare professionals. Take some time to read these quotations from some studies related to dissatisfaction among primary care physicians in the United States. Well, all of these signs of crisis, according to Mappes and DeGracia, point to the idea that ours is a system desperately in need of reform. Reforms that would have an eye toward what they refer to as the commonly accepted goals of a healthcare system. They insist we need more universal insurance coverage, better cost containment, more comprehensive benefits under the insurance programs we have, a higher quality of care, and greater freedom of choice for, I would say, both patients and providers that will increase patient and professional satisfaction with their encounters. through our healthcare system. Well, next time we'll take a look at the Patient Protection and Affordable Care Act, Obamacare, as one part of an attempt to reform our healthcare system.